Some news now. For the first time, Medicare has negotiated the cost of prescription drugs directly with drug manufacturers. This morning, the Biden administration is announcing new, lower prices for some of the most expensive drugs out there, including major medications that manage diabetes, prevent strokes and blood clots. The discounted prices see a drop of up to 79%. The White House says the savings are so significant, if they had been in place last year, it would have saved Medicare $6 billion. Joining us now, U.S. Department of Health and Human Services Secretary Xavier Becerra. Mr. Secretary, these are drugs many people take to basically stay alive. So what are the savings they're going to see? When does it begin? How does it work? How did you do this?
Yeah. So it is done. The negotiations are done. The prices are now final. They will be now put into the system and take effect for people to see on January 1st, 2026. It was a long process, almost a year of negotiation. And as you said, the savings are significant, more than what the Congressional Budget Office, the budget estimator for Congress, said it would be.
So what kind of a difference are people going to see actually at the cash register, picking up their drugs at the pharmacy? You've got drugs like Eliquis and Jardiance and Xarelto and drugs for diabetes and chronic kidney disease and heart failure. But give us a sense of what the numbers are.
Well, and because, the system, the health system is so complicated, made complicated so that way people can take money without being obvious. But in the program, Medicare, the program, you and I as taxpayers and folks who work to be able to earn their Medicare, we all paid through our taxes to shore up the Medicare program. And then once you're a Medicare beneficiary, you sometimes have to add a copayment out of your own pocket for that drug that you're about to get. Those co-payments, what you pay out of pocket, will come down. In fact, the estimate is by about $1.5 billion for those Americans who take these 10 drugs, because we were able to drive the cost of each of those drugs down significantly. So the program, Medicare, saves, as you said, about $6 billion in this first year. But Americans who are beneficiaries within Medicare, who have to pay out of pocket, will save an additional about $1.5 billion collectively.
So, Mr. Secretary, if you're on Medicare Part D, D is in Delta, and you're going to get your prescriptions, how much are you going to save in January 1st, 2026, and why isn't it January 1st, 2025?
Well, we would love it to be September 1st, 2024, but you have to give time for the new pricing to take into to get inputted into the system all over the country. Congress called for it to be effective in January 2026. We're going to start the negotiation for the next round of 15 drugs that will take the prices will take effect in January 2027. So it's going to go on like that. I can't give you a specific number that each person will save, because each person has different insurance within the Medicare program, pays a different amount out of their own pocket, but they will save money because we're reducing the overall cost of drugs, and therefore the insurers within Medicare can save money and pass that on to those who are on the system.
Mr. Secretary, I have a kind of little two-part. First of all, to follow up on what Mike was just saying, it seems kind of implausible in this day and age of things moving so fast that it would take a year to get just drug prices in the system. Can't that be done much quicker than that if it's really just a kind of internet thing? And the second is, what impact might this have on research and development, which is something that drug companies always say is the reason they can't lower prices?
Caddy, we could input it and have it in effect sooner, but by law, it's supposed to take effect January 1st, 2026. By law, we had to announce the price negotiation completion of it by September 1st of this year, so we're slightly ahead. But the Congress, when they passed this Inflation Reduction Act prescription drug provision, they were pretty specific in a lot of the items. And one of them was when we had to complete the negotiations and when those new prices would take effect. Congress could change that. They could come back in next month and say, well, we'd rather have them take effect as quickly as possible. We'll then do everything we can to implement whenever they say. But January 1st, 2026 is when they take effect. The second question, Caddy, was?
R&D, which is what drug companies often say would happen.
Well, listen to what the drug companies themselves had said to Wall Street and to their investors. They've said that they can absorb these savings that Medicare will see. They've never indicated that they're going to have to cut back on their research and development. Innovation will continue because we reduce the price. They're still making money.